This video reviews essential concepts in intraoperative nursing management. We will discuss the surgical team roles, operating room environment, principles of surgical asepsis, and patient safety considerations. Understanding these concepts helps nurses anticipate risks and promote safe surgical outcomes. The intraoperative phase requires vigilance, coordination, and adherence to aseptic principles throughout the procedure. The intraoperative phase involves a coordinated multidisciplinary team working toward a common goal. Each member performs specialized roles to maintain patient safety, surgical efficiency, and aseptic technique. Effective communication among team members reduces errors and improves workflow. The perioperative nurse plays a central role in coordinating activities and ensuring continuity of care throughout the procedure. Patients entering the operating room often experience anxiety, fear, and loss of control. These emotional responses may increase physiological stress and affect recovery. Administration of anesthesia reduces protective reflexes and alters cognitive function, making the patient vulnerable to injury. Immobility during surgery also increases the risk of pressure injuries, hypothermia, and complications related to positioning. The circulating nurse manages the operating room environment and coordinates intraoperative care. This role includes monitoring patient safety, maintaining aseptic practices, and ensuring necessary equipment is available. The circulating nurse also communicates with the surgical team and documents intraoperative events. Continuous assessment allows early identification of complications and promotes safe patient outcomes. The scrub nurse works within the sterile field and assists during the surgical procedure. Responsibilities include preparing instruments, maintaining sterility, and anticipating the surgeon's needs. The scrub nurse also performs sponge and instrument counts to prevent retained surgical items. Maintaining strict aseptic technique is essential to reduce the risk of surgical site infection. The surgeon performs the operative procedure and directs the surgical team. This role includes making intraoperative decisions and ensuring adherence to aseptic technique. The surgeon collaborates closely with anesthesia and nursing personnel to maintain patient safety. Effective leadership and communication are critical for efficient surgical workflow and positive patient outcomes. The anesthesia provider is responsible for maintaining physiological stability during surgery. This includes airway management, administration of anesthetic agents, and monitoring vital signs. Continuous assessment of cardiovascular and respiratory status is essential. The anesthesia provider also manages fluid balance, pain control, and emergency situations that may arise during surgery. The operating room environment is designed to minimize contamination and maintain sterility. Areas are divided into unrestricted, semi-restricted, and restricted zones to control traffic flow. Temperature, humidity, and air filtration are carefully regulated. Proper attire and limited movement within the OR further reduce the risk of infection. Surgical asepsis prevents the introduction of microorganisms into the surgical wound. Only sterile items are allowed within the sterile field, and contamination must be avoided. Movement and air currents are minimized to reduce microbial spread. Strict adherence to aseptic principles is essential to prevent postoperative infections and complications. Patients undergoing surgery are at risk for multiple complications. These include hypothermia, pressure injuries, nerve damage, and bleeding. Anesthesia and immobility further increase vulnerability. Continuous monitoring and preventive interventions help minimize intraoperative complications. The operating room contains several potential hazards for both patients and staff. These include exposure to lasers, blood and body fluids, latex, and electrical equipment. Radiation and fire risks are also present in certain procedures. Adhering to safety protocols reduces the likelihood of injury and ensures a safe surgical environment. Safe intraoperative nursing requires coordination, vigilance, and adherence to aseptic principles. Continuous patient monitoring and environmental control are essential. Understanding team roles improves communication and efficiency. Early identification of risks helps prevent complications and promotes optimal surgical outcomes.
Please like, share, and subscribe, and leave your questions as comments.